Of the fertility conversations. Today we are having Dr. Shei joining us to please invite your friends as well to join us. Dr. Shei is, yay, finally. I'm not sure what was happening.
Finally,
Yes, how
I
are you
don't know. I
doing?
think it's the network.
How are you doing? Thank you
I
so
think it's
much
the
for
network.
joining us. Can you hear me?
Yes, I can hear you. Can you hear me?
Yes, I can hear you. Yay. Thank you
How are
everyone
you?
for joining us. I'm doing great. How are you doing, Dr. Shei?
Good evening.
Thank you
How
for
is
always
everything?
making time for us to educate us about
That's what we are
fertility.
here for.
Thank you,
It's always nice.
everyone.
It's always there to be here with you. Anyway, it's always nice to
Yes,
be here with you.
thank you. Thank you so much for always making the time. Thank you, everyone,
Yeah.
for joining us today. Dr. Shei is joining us to educate us and also answer our questions about factors that can cause female infertility. So please share this video with your friends and family as well so they can join us. We have Dr. Shei here with us, who's going to answer our questions. He's a really busy doctor, so we're glad to have him here with us to be able to assist. So Dr. Shei, please, if you want to introduce yourself, let everyone know who you are for those that might not already know who you are.
All right. So I'm Dr. Shei. Um, my full name is Adele Shei, and I'm a gynecologist and also a fertility expert. I've been practicing for about 15 years now in this field, and I've been able to help a lot of couples from conception to delivery. And over time, during my practice, I found out that a lot of couples, their problems are due to lack of information. You a lot of pregnant women die because they don't have the right information. A lot of couples are having difficulty with conception because they don't have the right information. And information is the key. And that was one of the reasons why I started um, online profiles to be able to talk with people and give information as per what you need to do to conceive, when you conceive, to maintain your pregnancy, and also have a stress-free delivery. So that's all Dr. Shei is about in a nutshell.
Thank you so much, Dr. Shei. We love all that you do. We love you, your passion about educating us and helping individuals and couples globally who are trying to conceive and also helping them through the pregnancy as well. So while we have you today, we know what we wanted to speak about. We're going to be having a series of these sessions where Dr. Shei will go through different topics each time. Today, our focus is on factors that can cause female infertility. So if you please, Dr. Shei, as much as possible, want to share or educate us about what we need to know, and then we can go through the questions that we might have on here. For those who are able to answer here, otherwise people can reach out to you later for private consultations.
All right. So I usually like to talk to define or introduce infertility as the I mean getting the difficulty with getting pregnant over a period of a year in couple. Either um, it could be problem of the man or the woman, or it could be problem of both of them. We say a year in people that are 35 years and below, or lower than 35 years, and we say 6 months in 35 years and above. So reason being that if you are lower than 35 years, you have your prospect is still have a better prospect at conception compared to someone that is 35 years and above. Because once you are 35 years and you start, you are going close to 40, your fertility profile starts reducing. So that's why we don't expect somebody that is 35 years and above to wait for 1 year before they try to conceive. And infertility is not the problem of the women alone; it's a problem of the couple. Because especially in our climate, you know, in developing countries, in Africa, we have this notion that if there are problems with conception, it's definitely the problem of the woman. That's why you see a lot of women are the one that will be in the church praying to get pregnant. They have specific day of the week that is meant for women that are trying to conceive. You see women coming to the hospital. In fact, majority of the people we see are majorly due to infertility, and they come to the hospital, and it's majorly women. And it's when you now do the requested test that you now found out that the problem is not even the woman, the problem is the man. So it's not the problem of the woman alone. And if you look at the causes or the reason for infertility, there is the female factor, there is the male factor, there is both, and there is unexplained. The male and female factor, they take the equal share in the percentage of those that are trying to conceive. So if you have 10 couples, 3 of them will be due to problem of the woman, 3 will be due to problem of the man.
People
And
don't know
3,
this, Dr. Shea. People don't know this though. Like you said, they
well,
think
that's
it's
what we are trying to do to let people know, and
yeah.
that's what I try to do, especially in the clinic. Then when I have couples, I found out that some men do know, but the ego, and it brings down that masculine effect. So when you know that you are the cause of the problem, there is a way you will not be able to behave in the house again. You become so calm, you are always manning around. You won't be able to do all those things. So a lot of men don't want to lose that power. So I found that if you can try, that's why I try sometimes to see couples differently, because when you see them together, it affects sometimes. Even if it is the woman that has the problem, there are women that have secrets, that they have some secrets that they are keeping, and they won't come out if you see them together. And there are men that they know they are the problem and will not come out. They won't even come to the hospital because they know they are the problem. They will refuse to do tests. But with adequate enlightenment, people are, at least a lot of men are getting to know. Some are going to do their own tests before they even get married. They are going to do their own tests before they even talk about seeing a doctor. So it's both men, women, and also it could be the two of them. And sometimes you cannot even know, you cannot find out why they are not getting pregnant. You just know that when you do all the tests, everything is fine, but they are not just getting pregnant, and that's what you call unexplained infertility. And it happens in about 10 to 20% of couples are having problems with conception. All right, so the causes of female infertility. Now, for a woman to get pregnant, there are 3 basic factors that must be accomplished. 1, the woman must be having regular release of eggs, which is ovulation, because it's the egg that the sperm will fertilize for conception to happen. So if the one is not ovulating regularly, then that means the likelihood of conception is going to be affected.
Right.
Then there's something we call fallopian tubes. There are 2. They're just like a rope joining the womb to the ovary. Ovary is where the eggs are being released from. So they are just like a bridge. And let me use a bridge, because the bridge is the one that is through that bridge that the egg will come into the womb. So it's along that bridge that the sperm will go and meet the egg and fertilize the egg. So that those fallopian tubes, they must be functional and they must be opened. There are a lot of fallopian tubes that are not functional. They are opened, but they are not functional. There are lots that are blocked totally. So they have to have a functional and open fallopian tube. Then the womb must be receptive. The womb must be receptive to the baby. Once there is fertilized egg and the egg comes inside the womb, it must be able to bury itself. We call it implantation. There must be implantation of the fertilized egg inside the womb. So anything that will affect these three processes will affect conception in the woman. So, and that is what majority of the tests we do, that is what it entails. So if you have ovulation now, so if there are ovulatory problems, what are the things that will lead to ovulatory problems in a woman? There are the common ones and there are the specific ones. Age is the major one. Age. As a woman increases in age, the likelihood of conception reduces because the egg status, the number of eggs that the woman has, start reducing. Even the highest is when the woman, during the time that the person is in the womb as a fetus. That's when you have the highest number of eggs, about 7 million. And once you are born, you have about 1 million. And by the time you are getting to the time that you start you start having menstruation, you reach puberty, you have only about 500,000. And it's those 500,000 eggs that will take you through your reproductive life to the time that you reach menopause. So majority of women, by the time they are getting to 35, they will have used majority of the eggs. And as you get towards 40, the amount of eggs that remain will have reduced. Then the status of the eggs, how viable those eggs are, will have reduced towards that age. And that's why the abnormal babies are more. They are commoner 35 years and above. You have people with Down syndrome, which is commoner after 40 years. Okay, commoner from 35 years and above. But once you are 40, 45 years, the risk of Down syndrome becomes higher. So those periods, so as a woman age, the risk of having problem with infertility increases. So that is the major one. Then you look at the lifestyle of that woman. A lot of women, they drink alcohol, a lot smoke. And even if they are not smoking, they move around smokers. All these things, they have effect on ovulation. They have effect on the status of the eggs. There are a lot of eggs that are bad because of the fact that the woman smokes or the woman is a secondary smoker. Because if you are a secondary smoker means that you are inhaling. You are not the one smoking directly, but you are inhaling the smoke, the cigarette smoke around. So once you inhale, you have more of those toxic chemicals coming into your body compared to somebody that is even smoking. So those chemicals, they have damaging effects on the eggs. They damage the eggs, they damage the DNA of the eggs, they affect the eggs in a lot of ways. So once a woman smokes or takes alcohol, it affects fertility. Now there is something that is getting commoner these days, in the days of makeup. People do makeups now. People use different creams now. The people want to become lighter. All these things. There is something we call parabens, and parabens are they're actually not only in creams. They're not only in creams, in soaps. They're even in food. They are preservatives. We call them parabens. They are preservatives. You see them in almost, or even in toys. They are in toys. So they preserve those stuffs. Right. They preserve them. They preserve the creams. They are used to preserve creams, sunscreen, soaps that we use. And the way we use them now has increased. So researchers are now more into this to see the effect, because there is an amount that you are supposed to have in your system. When you eat and you take, people should be looking, when you look at your cream, you should look for parabens. There are different types. There is methyl paraben, there is butyryl parabens, there are a lot of them. But you just check, you will see that a lot of these creams, they have what we call parabens. Now the problem with parabens is that they have what we call estrogen-like effects. they work like hormones, like estrogen hormone. So the effect will be that it will now change, it will cause hormonal imbalance.
Wow.
In fact, not even only in men, it affects women too. I mean, not only in women, it affects men too, because it's it has effect on all these all the things, the egg, it has effect on the sperm. So these parabens are very, very, very important. So that's why when you're trying to conceive, you have to look at what you are using. You have to look at the medications you are using. The medication is also very, very important. There are a lot of medications that you are not supposed to use when you are trying to conceive. There are medications like people that have psychosis. There are antipsychotic medications that when you are trying to conceive, you must let your doctor know you are trying to conceive, because this can affect ovulation. It can affect it can even affect the baby. If you get pregnant, it can cause miscarriage, can cause missed miscarriage. So these are all these medications, they are all embedded that they can affect a woman's getting pregnant. So parabens, when you are trying to conceive, you need to also be careful with what you conceive, and what you consume, what you use as your cream, what you use for sunscreen. All these things, they are important. They affect ability to conceive. So then you look at, apart from the parabens, you look at we've talked about the age, we've talked about lifestyle. You look at weight. Weight is also very, very important. Weight is very, very important. Either you are overweight or you are underweight. Both are bad, because there is a particular level of weight that you're supposed to reach, that your brain will see that you can start ovulating, you can start menstruating. That's why you see all the people that have eating disorders, these anorexia, that they look thin, at the point in time they won't menstruate again, because there is a critical body weight that you're supposed to have for you to be able to carry a pregnancy. So once you are not at that weight, you won't start menstruating. That is the body has been programmed to understand the weight to start. So once you reach that weight, you start menstruating. Once you go below that weight, you stop menstruating. So when you look at your weight, not only for you to not only against getting more weight or becoming obese, being underweight is also an issue. So people should keep in mind. So if you are trying to say, I don't want to become big, I'm watching my weight, you should also not become underweight. Right. So these are important things that can affect you getting pregnant. So they can affect what we call ovulation. Then there are hormonal imbalances. There are some things that can cause hormonal imbalances. The hormones are chemicals that regulate, they are released from the brain. They go to, we call it hypothalamic pituitary ovarian axis. They are hormones that cause that interaction. That from your brain, it releases those chemicals. Those chemicals will be released from the brain, and they will come and act on the ovary to grow eggs. And at the point in time, one of the hormones also will help to release the eggs. Now, anything that can affect these processes, right, that can affect those hormones, will cause problem with conception. So if you have polycystic ovarian syndrome, for instance, polycystic ovarian syndrome is a form of hormonal imbalance. It causes hormonal imbalance, and it can cause an ovulation. The person will not ovulate. And even if the person ovulates and get pregnant, it's difficult to get pregnant. And even if the person gets pregnant, the person can have miscarriages because of that hormonal imbalance and the problem with it. We have prolactin. Prolactin secretes breast milk. But when it is high, to an extent, it affects ovulation. That's why you see pregnant women or women that are lactating, that are breastfeeding. You find out that a lot of times they don't get pregnant, especially if they are breastfeeding constantly for the first 6 months. Majority don't get pregnant. In fact, some people don't get pregnant until they stop breastfeeding totally. So because once milk is being secreted from your breast, or your prolactin is high, the body sees it as maybe you just gave birth.
Right.
That you don't need to get pregnant again, and you are breastfeeding a baby, you are giving a baby, you are taking care of a baby. So the body will not allow you to ovulate. It's the way God regulates how the woman's body is, so that you won't just be getting pregnant like that. No, it gives space so that it reduces the number of times you get pregnant. So prolactin also can have that effect. Thyroid hormones, whether it is high or it is low, they can affect ovulation in women, because thyroid hormone is just like they are the one that determines how our body functions, the metabolic rate at which our body. That's why if you look at a car, you say the car is slow, or the car is moving at or is working at optimum level.
Right.
It's the same thing with the woman, or even with human beings generally, and even animals. The thyroid hormones, they are the ones that determines the level at which our body works. So if that level is not optimal, the body will not see a need to get pregnant. Because if you get pregnant with a body that is not optimal, the person is likely going to die, or there will be one problem or another. So thyroid hormone problems, they can have effect on a woman ovulating. These are major problems. Then there are some other medical conditions that a woman can have that will affect ovulation: hypertension, diabetes, renal problems, even heart problems. Body will see them as this body is not stable enough to carry another baby. So it will switch off some other things, and the person will not be able to get pregnant. So these are major things that, if you are having all these things, the likelihood of being able to conceive is going to be affected. Then we have, we talk about regular ovulation. Then we have the tubes. The tubes, like I said, they are the bridge that links the egg and the womb. Now, the problem with this bridge is that it must be functional. Apart from being opened, there are some things there's something that looks like hair inside the tube,
Right.
that sweeps the head towards it sweeps it towards the womb. Now, if they are affected, we call them cilia. If they are affected, the function of the tube is already damaged. So moving the eggs to the womb is already affected. So, but apart from that, if the tubes are blocked, the sperm will not be able to get to where the eggs are.
Right.
So naturally, it will be difficult for that woman to get pregnant naturally. But artificially, through other means, the person can get pregnant. But generally, once your tubes are blocked, and what are the things that can cause tubal blockage? Majorly infections, pelvic inflammatory disease, sexually transmitted infections from surgeries. Maybe there are pelvic surgery, appendicitis that got infected, tubal surgeries. Maybe somebody had ectopic pregnancy. The tubes are already blocked. Already cut off. Then there are other surgeries that the person might have done. Fibroid surgeries, CSF, cesarean section, if it got infected, or even after vaginal delivery, and there is a form of infection that enters into the womb, and all sorts. This can block the tubes, and once the tubes are blocked, the probability of getting pregnant naturally has already been gone. So that person will not likely conceive naturally.
Right.
So another one is what we call endometriosis. Endometriosis is, inside the womb has 3 layers. There is the outermost layer, the inner layer, and the innermost layer. Now, the innermost layer is what is shed out as menses. Because once it grows, it's just like when you have a plot of land that you are not using, there will be weed growing, and then you cut off the weeds and remove the weeds out. So it's the same thing. Inside the womb, it's like a carpet. It grows. So if it grows in anticipation that the person will get pregnant,
Right.
and then it will know, so that the soil will be enough for the egg to burrow in and get implanted. So once the person does not get pregnant, it sheds out. So that shedding out is when you see your menses. So these endometriosis now means that instead of those innermost parts to be inside the womb, they are now outside the womb because it's an abnormal location of that thing is not supposed to be anywhere than inside the womb. So if it moves from inside the womb and now moves outside the womb, it's going to cause problems. So you see a woman that is having severe menstrual cramps, also trying to conceive. Sometimes they can have painful sexual intercourse, especially during deep penetration. So this is a sign, or these are signs of, or symptoms, sorry, these are symptoms that the person may likely have endometriosis. Is having difficulty with conception, have severe cramps. Then when you have sexual intercourse, it's painful. It may be a sign that the person has endometriosis. And this endometriosis can block the tubes, can damage the ovaries, make it difficult for ovulation to happen, can do a lot of damages, can cause additions inside and all sorts. So that's another one that can be a reason why a woman will not conceive. Then when you look at the womb is very, very important, because if you look at the womb is where the egg gets an implant. So anything that will affect implantation of the fertilized egg, anything that will affect it will affect the womb. It can be like fibroids. If fibroids there are a lot of women that have fibroids, but the location of the fibroid is what is actually most important. If the fibroid is inside that carpet that we talk about, that innermost part, if it's inside that part, it can disturb the pregnancy from happening. It's just like when you want to, or even if the person gets pregnant, it can cause miscarriages. Just like when you plant maybe maize or something on a rocky soil, it won't definitely, if germinate then later die. That's just the way it is with fibroids. It could be that the tubes, the inside the womb itself is already glued together. That's when you have additions affecting, we call it Asherman syndrome, or Asherman's, or uterine synecdoche, in which the tube, the inside of the womb is already glued together. Maybe the person had an abortion that was not adequately taken care of. Maybe the person had the abortion where an expert did not do the procedure, and it got infected, or they did it abnormally, and from after a while the thing got blocked. The whole of the womb can be blocked, and from there the person will notice that initially we usually menstruate for 5 days. Those ones that you will not menstruate for more than a day or two. Maybe you use 5 pads a day, or 2 pads or 3 pads a day. You may not even use anything during your menstrual period. So these are signs that you may have what we call uterine synecdoche, that the womb might have been glued together. Then there is something we call adenomyosis.
Right.
Instead of the thing being outside, that innermost part, instead of it being outside the womb, is now embedded into the womb. So it will look like fibroid too. It gives the same symptoms like fibroids, but
So is it like the opposite of endometriosis?
You said?
Is it like the opposite of endometriosis then? Because endometriosis, what was
Yes.
inside is supposed to be outside.
Instead of going outside the womb, it now enters deep into the womb. It's not supposed to be it's not supposed to be more than the innermost layer, but
Right.
now getting into the inner layer, where the muscles are, it's now entering into the muscles. So it now forms something that looks like fibroid, but it's actually not fibroid. But it's difficult because it looks like fibroid.
Right.
So it can affect conception too. So these are the major reasons why women may not conceive. And I think if there are questions, let me, so that we won't continue like that.
Wow, thank you so much, Dr. Shea. I just feel like I'm sure everyone listening to you right now feels like we know so much. You've literally given us like an entire training and education on what potential issues could arise and cause female infertility. Thank you so much for taking the time to provide that much in-depth information. It really, really helps. Thank you. And you had lots of good reviews here as well. People showing lots of hearts and people saying that they learned so much. So thank you so much, Dr. Sheyi. Some questions here I'm going to read off. Some, if the questions are a little too personal, it might need for you to contact Dr. Sheyi privately, so that way he can provide a more specific response to your case. So someone here highlighted she has low AMH and high FSH at 30. History of miscarriage, what are possible realistic outcome or best approach going forward? I'm not sure if that's something you want to answer here, or
low AMH is a major. AMH is what we use to determine the response of the ovary to stimulation. And it's as the person ages, it reduces. They are produced by the ovary. So like I said, that as you age, the status of the eggs starts reducing. So it shows that by the time you start having low AMH, that means your response to stimulation, if you want to try to help you to get pregnant now, your response will be reduced. That's why she said she has
high FSH.
Yeah. High FSH means that what FSH does is that it tries to work on the ovaries. It's the one that will come and tell the ovary, start producing eggs. We need eggs to be produced, so that this person can get pregnant. Now, when the eggs are not being produced, the brain will sense that it's not seeing estrogen from the ovaries. The estrogen is not coming to tell the brain that, okay, reduce the they're already producing.
Sorry, Dr. Sheyi, we're having a bit of a network issue.
See that it will send more FSH. Oh, is it network? Is it my network?
Yeah, I think there's a little bit of network issue.
Is it my own?
It sounds better now. Yeah, it's better now. Yeah. So we missed you from the point where you said that hello, can you hear me?
Yes, I can hear you now.
Okay, so we missed you from the point where you said that if the brain sees that there isn't enough eggs being produced, then what does it do?
So the brain will now send more FSH, so that it will tell the ovary, we need you to produce eggs. But when the FSH start getting very high, that means that the ovary is likely dead. So it's just like you are flogging a dead horse. So by the time the FSH is really, really that high, then that means that something is wrong with the ovaries.
Right.
So that means and it usually happens in people that are 40 years and above, that are people that are already menopausal, that have reached menopause. In such people, their FSH is very, very high, because they already reached menopause. That means their ovaries are not responding to stimulation by the FSH. So like that person now, if we now say, okay, let's give you medications that will help you to grow eggs, the likelihood that you will respond is going to be very low, because the AMH is already low, right, and the FSH is already high. So it shows that the person likely has ovarian failure. So what the person can do is to get a donor egg and do IVF. So such a person will benefit from IVF and donor egg. Donor egg, just like you are getting blood from someone. It's just like blood transfusion. If you need a blood transfusion, you get blood. Somebody donates blood for you. It's the same thing as egg. You donate eggs for people. There are a lot of people that are getting pregnant now just because they got the eggs from someone else, and they can be called mother. There are a lot of people that have, it's not only about genetics that makes you a mother. It's about that complex of a mothership, that ability to take care of a child and see the child as your own, that's what makes you a mother. So if such person will benefit from egg, donor, and IVF.
Okay.
That's just the truth about the whole matter.
Thank you so much, Dr. Sheyi. And if you want more information, please reach out to Dr. Sheyi. He can see his Instagram handle here, Ask Dr. Sheyi, and he can definitely have a virtual consultation with you for more information. Thank you, Dr. Sheyi, for highlighting about donor eggs as well. Someone here had mentioned that she has unexplained infertility and has used donor IVF, I'm assuming donor eggs, and also had implantation failure. So not sure. I mean, I think you highlighted some reasons why implantation might not happen,
yes.
but perhaps this person missed that. So if you could please.
Actually, there are other reasons why people can have implantation failure. There are some things that there are some cells that we call natural killer cells. These are like armies. You know, the armies that protects. It's just like when you have army in the country that protects the country. We have armies too that protect the body.
Right.
Now, these natural killer cells, they may not recognize that. Once they don't recognize that is part of them, you know, that is the part of the body, they attack it. And that's why when you have people that have transplantation, maybe kidney transplant, heart transplant, there are places of medications to suppress those cells so that they won't feed it, because a lot of failed transplant comes from those cells attacking the organs that were donated. So it's the same. It could be one of the reasons that the person had implantation failure. Like I said, I'm sure this person, if she had fiber, they will have removed the fiber, because fiber is one of the things that can also affect implantation failure. And sometimes we may not even know why the person is having problem with implantation. So if the person is financially buoyant enough and doesn't care, or no, I don't want to use care. Is not so rigid about the options. The person can consider surrogacy. The only issue is that if she's already having donor egg, so the person may look like she's not contributing anything to this cause. So if let's say that it's a egg now and the husband's sperm, they can consider a surrogate. Even with a donor egg, they can still consider a surrogate. The baby is still their baby. They are the commissioning parent. So if you have these kind of issues, if it is not the natural killer cells, and they have looked at all the other things, they've tried every possible options, and it's not working, surrogacy is another option, another way to go.
Right.
So they can consider that.
Thank you so much, Dr. Sheyi. And of course, if you do want more information or perhaps want to explore other details, please reach out to Dr. Sheyi. He does have virtual consultations, and that can be for anyone across the globe. Doesn't matter where you live. He's able to have consultations with you. Some of the questions I actually had as well, Dr. Sheyi, prior to this, I know you spoke about the impact of sexually transmitted infections. Someone had asked that she recently broke up with her boyfriend, and after breaking up, he reached out to her later saying that he had tested positive for chlamydia. And then she then went to the hospital and got tested, and she was positive, and she got treated. So she's not wondering that could this issue impact her when she tries to have kids in the future?
Well, the good thing was that she got tested and she got treated. Because once you get treated and you get treated on time, the effect may not really be that much. Most of the reason why sexually transmitted infection causes tubal blockage or destroys the tube is because of the long-term effect of the organism on the tubes. So let's say that she got to know that she had that infection and she went to the hospital and she was treated on time. Then she shouldn't worry about any effect, as long as, if it's not too late for her to get treated, and the tubes are fine, she shouldn't worry. It may not really have any effect. The most important thing is she has been treated, and the timing of treatment is also important, because a lot of women, they may not even know that they have that kind of infection, so they will keep it, and it will have destroyed their tubes, will have blocked their tubes before they get to know. But let's hope that she got treated early, and once she's treated early, I don't think there's any problem for her.
Okay, thank you for that. And so, can she then perhaps get HSD to check out the tubes then to see if it's opened?
Yes, she can. She can if she wants to, but to what end? So that she will know what her options say, what her options
for the future.
Well, she can, but she should just allow her body to. She should give time first.
Right.
Because if she just got treated and the chlamydia are not totally eradicated from the womb, and she goes for HSG, HSG can push. And HSG you push them into the body.
Right.
So which could be another problem. So she should at least allow her body to recuperate for a while, maybe about 3 to 4 months or 3 to 6 months before she plans going for a test.
Okay. Thank you very much for that. And you also talked about alcohol impacting fertility potentially. So someone asked as well, is it that they cannot drink any form of alcohol? What if for a glass of wine when they go out for dinner? Or
what I advise women, or even men, if you are trying to conceive, it's just a matter of time. It's a limited number of times. Once you get your baby, you can, as long as after you finish breastfeeding anyway, you can drink yourself to stupor. That one doesn't change anything. But when you are trying to conceive, as much as possible, I think you can do without alcohol. You can do without it, just for you to get pregnant and have your babies. Then once you have your baby, you are fine. You can take anything you want to take, and it goes for men too. There are men that their major problem is that alcohol that is affecting their sperm status. There are a lot of men with low sperm count, with problem with sperm motility, just because of that alcohol, and they are finding it difficult to leave their alcohol, and they are not getting pregnant, and you are just wasting the woman's time because age is not on the side of the woman. So as much as possible, just let it be for the meantime. So once you are pregnant, you have your baby, you can go back and drink your alcohol.
Thank you. Very important, because I think that's something that many of us wonder about. So thank you for answering that question. And I also had someone that asked that her husband or herself, they use lubricants when having sex, and they've been trying to conceive for a while. Could the lubricants be preventing them from getting pregnant?
Yes. That's why they have to be careful the kind of lubricants they use. They should look at the kind of lubricant. I think water-based lubricants are better.
Right.
Maybe Pre-Seed, there are different types. I think Pre-Seed is the commonest one. I think it's water-based. Those ones, they don't have much effect on sperm, but they should check the lubricant that they are using, because majority of this lubricant, they also have spermicides and spermicidal effects. They kill the sperms. So if you are using lubricants and you are trying to conceive, then you should consider, is it that you stop using them, or you look for the ones that are sperm friendly. Just Google for the sperm friendly lubricants. They are important. If you don't use sperm friendly lubricants, then you'll just be having your sperm destroyed, and that person will not like to get pregnant.
Thank you so much for answering that, because that again is another important question. I have someone here as well in the comments highlighting that, do soft drinks have a harmful effect on the chance of getting pregnant? Soda.
Do what?
Soda, soft drinks like Fanta, Coke, any of those?
No, not really. The thing about it is that whatever you are taking, you should take it in moderate effect.
Right.
Soft drinks, no, but you shouldn't now be taking it like your life depends on it. You should take it in moderate quantity. Whatever you are doing, just do it in moderate quantity. But soft drinks, no, doesn't have any effect. Except you have problem with sugar, or maybe diabetes and stuffs. Then you may need to, and if you are trying to lose weight, then you should be careful with the amount of soft drinks that you take. As you are trying to lose weight and you are still taking soft drinks, then you are not working on, because it has a high calorie, it has sugar.
Right.
So you have to be careful with it too.
Okay. Thank you. One more question actually here, Dr. Shea, as well, is when people sometimes saying that she said that she has blocked tubes and she was told that it could be opened up. But there's also people that have said to her that blocked tubes can increase the risk of ectopic pregnancy. So are there really ways for blocked tubes to be open, or is that not really effective?
Yeah, actually there are ways anyway. It depends on the kind of blockage,
Right.
how bad the blockage is. There are some total blockages there's really nothing you can do. And I
Yeah, I can
can you
hear
hear
you
me
now.
now?
Yeah, you're back.
Seems
Yeah.
the phone is
Yeah, it's
okay.
back. Yeah.
Yeah. So there are some total blockage that you don't even need to try and see if you can open them up. There are some that through surgery they can be opened up. But the problem is that it has been found that the success rate is minimal.
Right.
So if you have blocked tubes, there are some that we can flush, especially if what is blocking it if there are mucus, when you have mucus plug or some things that you can easily flush out under a high force. Yeah, because you have some women got pregnant after that kind of flushing, but in majority of cases, if it does not, if it's not something that is amenable to surgery, or if it's not something that is amenable after flushing, if the person does not get pregnant, then there is really no need to even go for surgery, because there is IVF now. IVF has reduced this. In those days, is surgery that is done to try and see if we can open up the tube and as in reconstruct the tube to an extent, and so that it can help with conception. But the success rate is really, really, really low, maybe about 20%. But with IVF has increased the option for people with blocked tube, because you don't need your tube to get pregnant with IVF. So once you can do IVF, then the only problem is IVF also has a success rate. I always say it's 50-50 anyway. Some people say 30 to 50%. I say it's 50-50. It's either you get pregnant or you don't get pregnant. That's the way I say IVF. And the expenses that is attached to IVF makes it also a bit on the high side. A lot of people cannot afford it. That's why they try and look at, okay, maybe there is another way that we can sort out this tuber blockage. But the truth about it is that at the end of the day, by the time you spend so much on opening your tubes, if you put all those money together, it will get close to what you will use for IVF. Because if you want to do tuber surgery now, you will be opened up. It's like you do a laparoscopic tuber surgery, which is also expensive, or you are opened up and try to work. That one is cheaper compared to laparoscopy, but the success rate is low. So instead of wasting money by the time you do a tuber flushing, you do it once, and maybe you do HSG and it shows that your tubes are blocked. By the time you do HSG will even the form of tuber flushing. It flushes because it's also on a high level. The only thing with HSG sometimes is that sometimes when it says your tubes are blocked, it may actually not be blocked, because that high flow, that pushing at high flow, it makes the tubes to become spasmodic, just clamp
Contract.
up.
Okay.
So that person, when the HSG will see it as that the tubes are blocked. So in such an instance, then you should go for laparoscopy, diagnostic laparoscopy, where the tubes will be reviewed under direct vision. We will see, okay, yeah, the tubes opened and the tubes of, we can even push some dyes to see if it comes out. That one is more expensive than HSG, but it will show, you will be able to see the tubes, say, okay, these tubes are actually bad, or
Right.
these tubes are actually not blocked. Because in some cases, when the HSG says that your tubes are blocked, it may not be blocked.
Good to know. Thank you. Thank you so much, Dr. Shea. It's really been an amazing
Yeah.
session with you here. We have learned so much. Thank you for taking the time to educate us and to also answer our questions. For everyone that has joined us, thank you so much for joining us. Dr. Shea, so can you please highlight some of the treatments that you're able to do? I know that you offer virtual consultations so people can reach out to you regardless of where they are. But if you just
Yeah.
highlight some of the treatment options that you offer so people can reach out to you.
All right. So we have online consultation and physical consultation. Online consultation, anywhere you are in the world, you can always have an online consultation. I have patients in and outside the country that have online consultations with me, and then we have good results. The only issue is sometimes you may not be able to do the test you need to do. Especially in some countries, it's not easy to get some tests done. But online consultation has helped a lot of couples.
Right.
So you can come for online consultation if you are not in Lagos, or even if you are in Lagos and it's far. If you are not, we have locations in Ikorodu, Ikoyi, and Magodo. So if you are not close to any of those three
Areas.
locations, online option is your best bet. And now there are treatment options that we offer, but let me just talk about treatment options generally, and I'll tell you the ones we offer. Um, One thing that I know that a lot of couples are having problems with is sexual intercourse, and until a lot of couples go through consultation, and we have to explain, okay, this is how you should have sex, this is where you should have sex, this is what you should go and do. A lot of people got pregnant just by education. Okay, this is the timing for your sex, this is what you should do. Because a lot of them don't even have any issue. The only problem is they are not having sex rightly.
Wow.
So education is a major um, thing that we do to let you know, okay, these are your options. And that's one of the things you gain from online consultation or from any consultation, even if it's physical. We'll let you know, okay, these are your options, these are the things you need to do. Then there are other ones, especially if you have ovulation problems. We can do ovulation induction for you. There are various ways we do ovulation induction. We can use tablets for ovulation induction. We can use injections for ovulation induction, hormonal injections for ovulation induction. We just say, okay, we give you those things. I will tell you, okay, these are the times you should have sexual intercourse. Time sexual intercourse with it. People get pregnant through that too. Then we have what we call intrauterine insemination, IUI. These are It's not used for people that have blocked tubes. It's not. You can't work because it's just you are trying to enhance natural means of conception.
Mm-hmm.
This person, maybe she has problem with the ovulation, and you have tried normal ovulation induction with tablets, is not working. You try for a while. You graduate to what we call intrauterine insemination. What we do is, then if the man has some issues too, maybe some motility issues, then the sperm count is not too low, but it's not also at the level we need the sperm count to be. IUI
Right.
can work for such couples. So we offer IUI too, in which we just take the husband's sperm. Because what IUI does is you take that sperm, you wash it. There's a way we wash it, we prepare it, and we take it directly into the uterus, close to that tubes,
Right.
such that the distance it will take for the sperm to cover will be reduced, especially when you have
Okay.
sperm with problem with motility that are not moving well. So you have reduced the length of time it will take them. Because some sperms you can spend 3 days before they get to the tube, and the egg will have died by that time. Egg can only stay for 24 hours. So all we do is we just increase the chances, we increase the number of eggs that the woman will produce, then also reduce the length of time it will take the sperm to get to the tubes and fertilize the eggs. So
Okay.
we offer that too. Then major other ones is IVF. We have different types of IVF. We have IVF, the normal conventional IVF. We have IVF with ICSI. ICSI is intracytoplasmic sperm insemination, in which, when you have very, very, very low sperm counts, or you have the sperm that are not even moving, you can take the sperm and inject them directly into the egg. Just fertilize them directly. So it has helped a lot of couples too, that they want their own child, but they don't. The other does not have the adequate amount of sperm that is needed. So you can do that. Then we have offer surrogacy too. For people that are having issues with getting pregnant, or carrying the pregnancy. So these are options that are available for women that are having problem with conception. Right. But usually you start from the lowermost, and it depends on the test. Yeah, depends on the test that you do. You'll be able to stratify if the problem is just education. Just educate. Okay, everything is fine. Maybe you just take time, have sex at this point in time. Time sexual intercourse. A lot of people get pregnant. Then you now graduate to, okay, you have not gotten pregnant. Let's see if you can enhance your ovulation. If you enhance your ovulation and you time your sexual intercourse, some people will get pregnant, some will not. They will have to move to IUI. Then we may now have to move to IVF. So it's a process. Right. It's not just that you just jump and just go on, except if your option is just go for IUI immediately, or your option is go for IVF immediately. So that's the...
Thank you so much, Dr. Shea. That really helps. And of course, if people have done different tests wherever they are, you can then review the test and be able to advise the options based on the test.
We'll look at the test, then we can discuss the options.
Right. Yeah. Okay. Perfect. Thank you so much, Dr. Shea. It really has been amazing having you here with us. Thank you for your time, for your passion, for being so interested in educating us as a community and globally as well, to create awareness, to educate, and to support people that are trying to conceive. For other questions, please reach out to Dr. Shea, Instagram at Ask Dr. Shea. So that's at ASKDRSEYI. And he'll be able to respond to you, and then you can have consultations and advice on how to proceed. Again, like I said at the beginning, we'll be having more of these sessions. Please check out Dr. Shea's page and my page as well for updates on when the next the next IG Live will be, and for Dr. Shea to also be with us again and answer more questions. Thank you so much for joining us, and do have a great evening or afternoon wherever you're being joining us from, and a lovely week ahead. Thank you so much, Dr. Shea.
Bye-bye.
Have a great evening. Thank you. Bye.